All right, well, thank y'all for coming to my talk today. It sounds like it's on, I don't know. So I am Dr. Trevor Ling. I am going to be presenting you with health and wellness and an integrative model of care for physical therapists. So I don't know if some of y'all read the little bio, but I am one of the owners and founders of Peak Potential Physiotherapy and Wellness, along with Dr. Amanda Ling, who, yes, is my better half, who's not here with me. But we've been open for about 3 years coming November. I've been in the health and wellness industry working in physical therapy or athletic training for the past 15 years. So we opened up about 3 years ago, and then previously we had another franchise clinic that we had for about 6 years that we ended up selling with our partners about 6 years ago. And so the genesis of Peak Potential Physiotherapy kind of started with, we knew we could do something a little different and a little something better for our patients and clients. So it started off with my wife, who's a physical therapist as well, started in the home health care field. And I don't know, has anyone been in the home health industry or, okay, God bless y'all. Because I know I couldn't do it. If anyone's an outpatient, you might feel my pain a little bit on that. But so she was tired of dealing with this sick care model of healthcare. So I hate to say it, but when we took the paper, she would look at the obituaries and see if her patients were going to be there the next week when she was going to be coming in, which is morbid, but unfortunately was the time and the place that we had people. So what we've been going down is this journey of well care, and we thought, hey, let's do something different and let's try to bring this to our community. So this well care, or what we call health-facing model of physical therapy or healthcare in general, is a model of our business. So again, I'm thankful and happy to be here. I'm surprised and also happy that I thought there only might be 2 or 3 people here and listening to me, and I know some of them might have just been colleagues just trying to support me, which I am more than happy for them as well. So I also want this to be interactive. All right, so this isn't a lecture, this is a dialogue, not a monologue. I will be asking some questions. I would like some participation because this is new for me too. So I'd love some interaction between us. So today what I want to do is fill in any knowledge gaps that you may have, or to see your current understanding of what integrative healthcare is, and then how to expand on how we can use it in growing our businesses. So again, just to kind of get to know where people are, do we have anyone working in private practice here? Show of hands, anyone? Okay, we got one. Does anyone own their own business or clinic? Okay, good. So who else is just an outpatient orthopedics, or where are people kind of hailing from? So outpatient orthopedics, students, okay. PT students, all right. Are y'all interested in possibly private practice, or maybe opening up your own business someday? Maybe? Where are y'all students at? UT. Okay, excellent. PTA student, awesome. I just met Jennifer, so good. All right. So because this is a course, we obviously have some learning objectives. And again, stop me whenever you have a question, raise your hand, don't hesitate. We're in class. How about that? Okay? All right, so first off, we want to review the APTA stance on wellness in physical therapy. We're also going to differentiate between sick care and well care models, or what I call health-facing models in healthcare. Then we're going to describe the effective ways to implement wellness into an outpatient physical therapy practice, which is what I'm in, and depending on where y'all are practicing, where you might be able to implement it as well. And to also demonstrate how an integrative wellness model improves patient outcomes. So we'll be going over some case studies at the end as well. All right, so defining wellness. So the APTA defines wellness as a multidimensional state of being describing the existence of positive health in an individual as exemplified by quality of life and a sense of well-being. Hello. So I know some of y'all might have not gotten the handouts. However, they are on the website, so you can print them out if you want the copy of the slides or anything like that, okay? All right, the APTA also goes on to state that physical therapists are uniquely qualified to assume leadership in positions in efforts to prevent injury and disability, and fully supports the positive roles that physical therapists play in the promotion of healthy lifestyles, wellness, and injury prevention. So who thinks that this is actually being done in our profession today? Does anyone feel like it's a continuity of care? Okay, so that I'll take that as a no, just because I didn't see it, and that's why we kind of went out on our own to try to fill the gap. Now, I have found a like community doing that since I've gone out and been searching this out, but it's not necessarily the continuity of care in physical therapy practices now. So not necessarily converse to this, but we all look up Google, and Wikipedia says that wellness is actually an alternative medicine. So if it's an alternative medicine, it's kind of like, it's ethereal. People really don't know what's going on. But obviously the APTA has a good description of it. And it's also, they describe it as the absence of illness. So depending on what your definition is, with the APTA is basically just a state of being describing the existence of positive health in the individual as exemplified by a quality of life and sense of well-being. Pretty broad, but we'll try to hone down that a little bit and obviously make these a little bit more tangible definitions. So for our clients and most patients to be 100% healthy, we must address all areas of health, okay? So I say this as kind of a PSA here, we have to practice what we preach, all right? You probably have heard the term metabolic syndrome, these chronic inflammatory states. We can't sit there with a patient and tell them, hey, yeah, you actually should, be more active and do these things when we're running off to Chick-fil-A at lunch or having McDonald's and not practicing what we preach. So I just throw that out as a PSA. I've gone on my own journey on this. And so as we are in the healthcare field, obviously I just am throwing that out there. So I can take the best approach with manual therapy. I know there's some manual therapists in here, but I take the best approach with manual therapy, my Therax, my Theract. But if my patients continue to have a high level of inflammation or systemic inflammation or even a deregulated nervous system and an unstable blood sugar, their root cause of their pain and illness is not going to be addressed. So the APTA's mission even now includes the verbiage to further the profession's role in the prevention, diagnosis, and treatment of movement dysfunctions and the enhancement of physical, healthy, and functional abilities of members of the public. So they obviously support this WellCare or health-facing model. However, we also have to fall back on state legislation. Obviously, we're learning state by state. Everything's a bit different for topics about nutrition. So I will be talking about nutrition a little bit. Here in the state of Tennessee, only a registered dietitian are actually allowed to prescribe their dietary advice. However, we can screen and provide information on diet and nutritional issues as long as the information we provide is considered general knowledge. So meaning that they can go out and seek it themselves from reputable sources. So the layperson that comes in to see us, they don't know a whole heck of a lot. And at least we know how to read scientific studies. We understand kind of the whole, okay, is it a randomized control study? So we can collate that information and be able to present it to our patient without stepping on the toes of the registered dietitians here in the state of Tennessee. All right, so what is integrative health? So the World Health Organization defines just health as a complete state of physical and mental, emotional well-being. So again, pretty broad, but to be integrative in our healthcare model, we must address all of these areas. So through our therapeutic activities and exercises, patient education, tailoring our programs, and even expertise offered by others in our clinic, or through referrals to appropriate practitioners outside of that. this is how to be integrative. So other buzzwords that you hear for integrative healthcare out there, you have lifestyle management, you have lifestyle medicine, population health, medical fitness, even just medical neighborhoods. So you're trying to create this holistic environment for your patient. So we can stay true to our profession of physical therapy to drive this model, then create integrative health into our practice. So obviously, we're physical therapists, we're PTAs, that's where we start, physical therapy. So, but we can then create this integrative approach through that. So if we do not offer this service to our patients, what's the alternative? They seek it on their own, or other professions that are positioning themselves and who are doing this are going to do it for us, all right? So we could say even us, if we were sitting back and we watch these less skilled providers, or probably not even healthcare providers, not only take away part of this market share or this resource that we have to give to people, but also this just opportunity for us as a physical therapy profession. So we must be willing to think and step outside of our comfort zone of rehabilitation and take on the expertise into the realm of the prevention and integrative healthcare model. So to truly be integrative in our care and address the health of our patients, I feel we have four pillars of health, which I'll go into a little bit more later on. But they involve physical activity, nutrition, recovery, and psychological well-being. So the last part is shown to be popular recently, the psychological well-being. Okay, well, are we stepping the toes of psychologists and other kind of wellness people? No, they're going to be part of your neighborhood. However, just think of pain science. Who's heard of Adrian Lau and Lorimer Moseley? Yeah, okay. You've all read the research, you've heard of the pain science. And the thing is, we're treating their brain. But who else has the opportunity to have someone in front of you for 30, 45 minutes, an hour, where you have their undivided attention? Do your good manual therapy, do your good Therax, but we're educating them at that time, okay? So don't get caught up on these things. We're treating the person, all right? It's the person, not the patient. All right, so our current healthcare model. So healthcare in the United States is in a time of change. The conventional go-tos of prescription drugs, surgery, are being reconsidered by both healthcare consumers as well as the evidence-based researchers. So with all the advances in medicine and technology, the non-communicable diseases or chronic diseases such as heart disease, type 2 diabetes, metabolic issues, or autoimmune diseases, they continue to rise, and researchers are finding that the conventional treatments, although they are effective in the acute conditions, do not address these causes in chronic disease. So in 2012, and I'm sure it's much higher by now, the CDC reported that half of all adults in the United States have a chronic health condition. So just let that sink in. Half of all adults have a chronic health care condition. So the percentage, I know the percentage of our clients that fall into this category, I know is more than 50%. But who, by a show of hands, would think that that percentage is higher in the clients that you might see in the clinic? Okay, so it's becoming an epidemic. All right, so the sick care system just isn't working. So since our profession is the quintessential non-invasive practitioner, we have an amazing opportunity to maximize patient outcomes, their quality of life, by implementing this wellness component into our practices and take on the well care or this health-facing model of health. So as we spoke before, I don't care what you really call it. I just use integrative health as what I say, but it could be medical fitness, could be population health, lifestyle medicine, or even lifestyle management. All right, so this is a pretty cool little thought picture. So this is how I see our well care or health-facing model. All right, so this graphic I adapted from, it was actually a podcast by Mike Eisenhart. He's a PT who's running an amazing integrative health clinic up in New Jersey. I actually got to talk to him on the phone, but it stuck with me for probably almost the last few years. And I asked him, I was like, do you actually have a graphic of it? And he said, no, I don't have it. I was like, do you mind if I do it? And so I was able to bring this up, but this is obviously the preventative health or pre-disease. So we, or traditional healthcare, we are pulling patients away from this disease model or this sickness model. When we as physical therapists and in our profession are able to actually push people towards health. And this is exactly what Amanda was talking about when we started on this journey of creating peak potential physiotherapy. It's like, people have to go towards health. And if we can do that, is then we can obviously stop some of these chronic disease and inflammatory issues and stop having them rely on medications, injections, and surgery. So despite consistent recommendations from the most respected medical associations over the last decade, clinical practices regarding lifestyle medicine have not improved much. So some research has consistently reported that the majority of clinicians do not routinely screen or assist patients in modifying their health-damaging behaviors. So these are these modifiable risk factors that I was talking about previously, so the 4 pillars that I'll go over later. But here's one that just boggled my mind. So only 1 in 8 primary care physicians was even aware of the ACSM recommendations for physical activity. So does anyone know the ACSM? Okay. What are the recommendations? Do y'all remember? I'll put y'all on the spot. So it's 150 minutes per week, okay? And I think it's the cardiology, it was like the board of cardiology was the 30 to 45 minutes most, if not all days. So 1 out of 8 primary care physicians didn't know this, that they need to get their patient moving, okay? All right, so another one that jumps out is that it's just showing that the sick care model is not working. Less than half of smokers report that their healthcare professional has advised them to quit in the past 12 months. Everyone knows that smoking is bad. We know it's a habit. We know that there's obviously an addiction there, but just the fact that you can introduce that to someone, what if they stopped? What if they cut back by half? Okay? So obviously there's a lot of room for improvement, and we as a profession are in a prime position to be able to do something about it. So the 4 pillars of health. So now that we know what this health-facing and well-care model looks like, hopefully it's burned into your brain like it has been for me, what it looks like and how it's been defined, I'm going to show you how it's implemented. So returning to the 4 pillars that I mentioned previously. By addressing these 4 pillars of health, we find the root cause of the problems. We're not treating the symptoms, we're treating the cause. So something that always sticks in my head, correlation does not always equal causation. So trying to find the root cause of the problems people face on their health journey, we hear it all the time. It is a journey. It's not the destination. We're not going to just get there. We have to continually go down this path. So everything really falls within these pillars. By addressing them, you treat the whole person and you find out what's delaying the healing. Why did their acute pain turn chronic? What are some of the root causes that led them actually stepping into your business or your clinic? I actually had someone yesterday who lower back pain, got better within a week. It was a disc issue. Comes back afterwards after we start loading him. He's like, I'm getting bilateral pain and all these things and no mechanism of injury. It took me an hour to get out of him that he had started some sort of supplement on the internet that he found. This is a physician actually. He's a podiatrist. He's like, oh yeah, I just started taking this 3 weeks ago. I'm like, I've been trying to get rid of this stuff for 3 weeks for you. We got rid of your normal back pain, and now he comes in with all these other symptoms. He's like, you know what? I know it had all this stuff that I didn't know what was going on, and he was still taking it. So now he's gotten off of that, and he's like, wow, I'm actually feeling a little bit better. So we don't know how our body reacts, and unless we actually go down that road of asking the questions, we're not going to get to the root cause, okay? All right. So physical activity, just to kind of go over this, we need to move. Motion is lotion. This is more of the PT-centric or the fitness part of things. So there's also this exercise versus our NEAT. Does anyone know what NEAT is? It took me a while to figure it out too, but it's the non-exercise activity thermogenesis. So this is anything besides eating, sleeping, and your sport, all right? So again, we're in the prime position. Why don't we teach someone? Park at the end of the parking lot before you go in. Why don't you take the stairs instead of the elevator? Things that you can actually start increasing their physical activity, which is beyond their need, which will actually push forward their wellness. So number 2 is nutrition. This includes food, hydration, supplementation. This is our fuel, all right? Basically, you want to get the healthy foods in and the bad foods out. That looks different for everybody. So there's not any cookie cutter issue when it comes to it, but again, with nutrition, with us, we are basically collating information for that person. We're not prescribing a diet for them. So number 3 is the recovery. This is stress and sleep, recovery tactics, active recovery strategies. You hear all the time, are you overtraining or are you under-recovering? So if they're not getting enough sleep, where does the body actually heal itself? Okay, it's in that deep REM sleep. And people don't even know that. They're like, oh, I can just keep going and going and going. I get moms all the time. It's like, oh yeah, I just go to sleep, and after I do all the chores, and I get 2 or 3 hours sleep, and then I'm up with the baby, and then I have another few hours before the other kids get up, and you're like, why is your back pain not getting better? Okay, well, I can only do so much. I can do the mechanical part of it. All right. So toxic load. This is also, I parallel this with the psychological well-being because it includes smoking, alcohol use, work hazards, mold, but this is the body's resilience. This is stress management. It's the use of good and bad stress loads, social dynamic, and the mental health. All right, so again, we're not taking or stepping on toes of those mental health professionals. We're trying to guide them to that, and it might be that we can just give them some tips to go on to be able to do that. So a study at the Mayo Clinic from 2003 to 2006 used 4 markers, all right, for a healthy lifestyle. They were sufficient activity, so 150 minutes per week, the eating a healthy diet, and this isn't like you gotta go low carb, keto, or carnivore diet, all these things that are out there. This is actually prescribed on the new rendition of the food pyramid, so it's actually not really that healthy. But it is eating a healthy diet, not smoking, and having the recommended body fat percentage. So knowing this, and this is in a population sample of 4,500, only 2.7% of adults had all 4 of these healthy lifestyle habits, okay? 2.7%. Out of 40, so the 4,500, that's a pretty large sample size. 2.7% of all adults have had all 4 healthy lifestyle characteristics. We must practice what we preach, okay? Yes, it was done in the Mayo Clinic from 2003 to 2006. So. All right, so how can we use wellness services to help our clients? At the very least, we can use education. We're doing it right now. We do it all day long. We educate. We have a captive audience when they see us. So here's another one for you. The Nurse Health Study, which was initiated in 1976 and has actually been running up until now. So it has over 280,000 participants. They followed and tracked health risks and how lifestyle changes affect them. It showed that when there is an improvement in diet, physical activity, and being a non-smoker, it leads to 70% of strokes being prevented, 80% of coronary heart disease being prevented, and 90% of diabetes being prevented. All of these chronic inflammatory responses are preventable, okay? Any questions so far? Clarifications?
What were the 4? Sufficient activity, no smoking, healthy life, or healthy diet?
From the Mayo Clinic?
From the Mayo Clinic.
Yeah, so it was sufficient activity, eating a healthy diet, non-smoking, and the recommended body fat percentage. All right, so poor nutrition and obesity can directly lead to a pathological condition can directly lead to pathological conditions that we as physical therapists are managing, or it can negatively influence the recovery of our movement dysfunction. So we are, again, uniquely placed in this healthcare field. How many patients come to you and say, you know what, if I just lost this, my back would feel a lot better? Everyone's probably heard that. Or my knees would feel a lot better, I know, if I lost some weight. Or When I was talking about the stressed out mom, if I just had a little bit more time to relax, I wouldn't have this headache that I have every day of the week. So my first reaction a few years ago was, you know what? It might be, or maybe that would be part of it, but that's not the only reason. And then I'd go on, I'd do my manipulation, my soft tissue work, and they'd feel better. Now, I ask, what have you been doing about that? Just open the door. What have you been doing to try to help that? Most of the time, nothing. So why are you telling me that you're going to do it? I mean, we have to tell it like it is. So if they're saying, yeah, I need to lose weight to help my back pain, what are you doing about it? Would you like some information about that? Can I help you along with that? Okay? All right. Since Medicare and most payers do not cover wellness services, a private pay model is used for services such as yoga, Pilates, strength training, nutrition, or massage. So some of you who might not be in a private practice setting is going to be talking to your supervisor, your anything. How are we going to implement some of this? But now also part of our education during the normal plan of care with physical therapy can be billed as patient education. So this is when each session we're speaking to them, when we have them on the table, when we're doing things, and we're talking about these lifestyle factors that are affecting their healing process or potentially the outcome or the reoccurrence, that can be billed as patient education. However, when we start getting into the coaching, into the counseling, into the motivational interviewing and dealing with the barriers that are stopping them from doing this, then it would fall outside that realm, and we wouldn't be able to charge insurances for this. So all of this is needed for actual change to occur. So to have a true behavioral change for the long term, these lifestyle risk factors have to be decreased. So if your facility does not offer these types of services, and after your general education is done during your PT plan of care, you have to refer out, you have to get them to the right people. So I'm primarily in network right now. We do these cash-based services, and these cash-based services provide the business with improved cash flow. So since we are providing this specialized service, we are the experts in musculoskeletal care and the workings of the body that they're not going to get at a gym or a spa or one of the studios or anything like that. Then we can set our rates, all right? And this is in accordance to our value, which are usually higher than market value. So this is going a little bit more into the depths of the business aspect of things, but this sends the message that we're providing a unique service. We're healthcare professionals, and we have our foot in this door, all right? So a little higher won't do it, because people then will cost compare. We're doctors, we're coming out with this higher level of education. The difference needs to be significant enough that people ask, why is that more valuable? All right. So we don't want to race to the bottom. We want to keep our profession at elevated status here, because that's what we deserve. So we need to come from a place that reinforces health, or this health-facing, if I remember correctly, health-facing this way, not just absences of pain or disease or dysfunction. You hear about all the time, oh, I can get rid of your pain, but what's the root cause? We got to go after that. So what we can readily integrate into an episode of care for our physical therapy that will lead to improvement of outcomes. So give me some examples. What do you think you can adjunct or put into into a person's plan of care that's outside of physical therapy that would help them with this? Any thoughts? Any ancillary services that you might want to give someone after you're done with them?
I treat vestibular patients, and I always encourage them to take that to the next level with getting involved in some kind of exercise program. That's a balance component.
Exactly.
To support what we've achieved with their vestibular rehab.
Right.
It's amazing the number of them that have not been given anything.
Right. They have, there's chair yoga classes, there's all these Tai Chi, there's a lot of different things. I've gotten a lot of connection. I mean, if you're scared of them going into a yoga class, there's chair yoga classes, there's floor exercises, there's anything that you can do, at least get them moving. So anything else that y'all might think about that you might tell someone, hey, why don't you go do this? We got Pilates, we have personal training, we have other things that you want to be able to give that person. But again, they're usually suggestions. We prescribe exercises. Why aren't we prescribing our discharge, what you're going to do afterwards to keep this healthy lifestyle?
So
Yes.
you're at first I thought you were talking about us actually doing those things.
Well, you can have it in your clinic.
Talking about referring them.
You can refer them out, or you can have it integrated into your own practice model. So I have a personal trainer who I refer to all the time, and she works within my clinic. So she's a contractor. I'm not providing the care. We were before we had a personal trainer. So we did what we called medical guided personal training, which we charged a cash-based fee for. But then again, we set out our time to be able to do that. Okay? So next I'm going to talk about the 3 ways that this can be implemented into our practices, as well as what we have done in order to do this. So this goes on to what we kind of talked about before. So number 1 is this complementary treatments that that would not be covered by insurance, but would help maximize these treatment sessions for people. It also might help actually get to their goals faster. So someone they're like, yeah, they need a lot of core work. Teach them how to turn on their core, get them to Pilates. So it could actually lead to fewer treatment sessions. So it could be a lesser cost to them paying out of pocket for services. How many deductibles do we see at $10,000? They're never going to reach that. So how can we maximize their time and dollars spent in order to do this? So this includes some of what you said, the yoga, the Tai Chi, those sorts of things, but it's like, okay, well, can I be able to integrate this into my own practice model, or can I have those referral outsources that would help as well? And so I know Jody was in here earlier talking about MIPS. I don't even want to open up that can of worms, but so I don't know if y'all have familiar with this merit-based incentive payment system that Medicare is going to in 2019. So basically, if you're not getting them better, you get paid less. They actually take money away from you if you don't get them better, okay? So the more that we can integrate and be able to get that person there faster with less dollars and even out of Medicare's dollars, then the better for our profession, the better for our clients. So yes?
I'm just curious, how do you approach your patients who say, well, I just can't afford that?
Right.
What do you say to that?
What do I say? It's like, well, how can you not afford it? So you always, for me, what is their draw? What is their internal driver? Sure, they come to you, they want to say, hey, I want to get rid of my pain. Ask them again. Well, I can't pick up my kid, all right? Well, can you afford not coming here and not being able to pick up your kid? Can you afford not being able to work? It's what is their internal driver that will actually lead them to a change? So when I go over the case studies, we have someone who was just like, yeah, I need to keep up with this. But you have to find out what we call the internal driver, or their why. It's not pain. That's the source. What's the cause? And then what are we trying to get them to? So when they say, I don't have the money to do it, okay. Well, there's a community center that has chair yoga. Okay, you have Medicare, then you go to Silver Sneakers. Okay, you don't? Well, here's my prescriptive discharge plan that I can lead you to water. Here you go. But I can also say that if you have a good relationship with them, so what did you spend your money on this weekend? Or I went out to Starbucks, went out to dinner, I did this. You do one of those things less, and you pay for what your health care is that you're going to be able to have for the rest of your life. So if you have that relationship with someone, which you should, that's the best thing about being our profession. We get to be friends with our clients.